Thyroid cancer is a type of cancer that originates in the thyroid gland, a small butterfly-shaped gland located at the base of the neck. The thyroid produces hormones that regulate metabolism, heart rate, blood pressure, and body temperature. Although thyroid cancer is relatively rare compared to other cancers, its incidence has been increasing over the past few decades. In today's video, All About You Tips will provide a detailed overview of thyroid cancer, including its symptoms, diagnosis, treatment options, and prevention strategies. First, what is thyroid cancer? Thyroid cancer occurs when cells in the thyroid gland undergo genetic changes that cause them to grow uncontrollably and form a tumor. While most thyroid tumors are benign, non-cancerous, some can be malignant, cancerous, and spread to other parts of the body. Types of thyroid cancer. 1. Papillary thyroid cancer. The most common type, accounting for about 80% of cases. 1. It tends to grow slowly and often spreads to lymph nodes in the neck. 2. Follicular thyroid cancer. Makes up about 10–15% of cases and can sometimes spread to other parts of the body, such as the lungs or bones. 3. Medullary thyroid cancer. Accounts for about 4% of cases and can be associated with genetic syndromes like multiple endocrine neoplasia type 2, MEN2. Anaplastic thyroid cancer, a rare and aggressive form, accounting for about 2% of cases. 4. It tends to grow rapidly and is difficult to treat. 5. Hürthle cell cancer, a rare variant of follicular thyroid cancer known for its potential to be more aggressive. Risk factors. Several factors can increase the risk of developing thyroid cancer. 1. Gender, more common in women than men. Age. Most cases occur in people aged 25–65. 3. Family history. A history of thyroid cancer or genetic syndromes such as MEN2. 4. Radiation exposure. Exposure to high levels of radiation, particularly during childhood. 5. Iodine deficiency. Low dietary iodine levels can increase risk. 6. Genetic mutations. Certain inherited genetic mutations can elevate risk. Symptoms of thyroid cancer. Thyroid cancer often does not cause noticeable symptoms in its early stages. However, as the tumor grows, symptoms may include 1. A lump in the neck, often painless but can be felt through the skin. 2. Changes in voice, hoarseness or voice changes that persist. 3. Difficulty swallowing, a feeling of food getting stuck in the throat. 4. Difficulty breathing, especially if the tumor presses on the windpipe. 5. Swollen lymph nodes, particularly in the neck area. 6. Neck pain can extend to the ears. Persistent cough, not associated with a cold or other respiratory issue. Diagnosis. Diagnosing thyroid cancer typically involves several steps. 1. Physical exam, initial assessment of the neck for lumps or swelling. 2. Blood tests, to measure thyroid function and check for elevated levels of thyroid-stimulating hormone, TSH, and calcitonin. 3. Ultrasound uses sound waves to create an image of the thyroid and identify any abnormalities. 4. Fine needle aspiration, FNA. Biopsy. A thin needle is inserted into the thyroid to remove cells for analysis. 5. Radioiodine scan. Uses radioactive iodine to detect thyroid abnormalities. 6. CT scan MRI provides detailed images of the neck and helps determine the extent of cancer spread. Treatment options. Treatment for thyroid cancer depends on the type and stage of the disease, as well as the patient's overall health and preferences. Common treatments include surgery. 1. Thyroidectomy, removal of partial thyroidectomy, or all total thyroidectomy of the thyroid gland. 2. Lymph node dissection, removal of nearby lymph nodes if cancer has spread. Radioactive iodine therapy, uses radioactive iodine to destroy remaining cancerous thyroid tissue after surgery. Hormone therapy, administered to replace thyroid hormones and suppress TSH, which can stimulate cancer growth. External beam radiation therapy uses high-energy beams to target and destroy cancer cells, often used for more advanced cancers. Chemotherapy uses drugs to kill cancer cells, typically reserved for anaplastic thyroid cancer or when other treatments fail. Targeted therapy, drugs that specifically target genetic mutations or specific pathways involved in cancer growth. Prevention and early detection. While some risk factors for thyroid cancer cannot be changed, certain measures can help reduce overall risk and facilitate early detection. 1. Avoid unnecessary radiation, especially during childhood. 2. Regular neck examinations, especially for individuals with a family history of thyroid cancer. 3. Genetic counseling and testing, for those with a family history of genetic syndromes associated with thyroid cancer. 4. Adequate iodine intake. Ensure sufficient dietary iodine, particularly in areas where iodine deficiency is common. 5. Awareness of symptoms. Promptly seek medical attention for any persistent neck lumps or other related symptoms. All in all, thyroid cancer, while relatively rare, requires awareness and understanding for early detection and effective treatment. Recognizing the symptoms and knowing the risk factors can lead to earlier diagnosis and better outcomes. By maintaining a healthy lifestyle, managing risk factors, and staying vigilant about changes in the neck area, individuals can take proactive steps towards preventing and managing thyroid cancer effectively. If you experience any concerning symptoms or have a family history of thyroid cancer, consult a healthcare professional for appropriate screening and guidance. If you enjoyed this video, please give it a thumbs up and share it with your friends. Don't forget to hit that subscribe button and ring the notification bell so you never miss out on our latest life tips and tricks. Thanks for watching.